Hi there. Here we are. We're now in the OR with our patient Jeff. Jeff came in about 1.5 years ago for his procedure, and we're now doing another max harvest hair transplant procedure on Jeff. What I want to demonstrate right now is I want to demonstrate what a follicular unit extraction is. I have patients that will ask us all the time about having a follicular unit extraction procedure. With the follicular unit extraction, you limit the amount of hair the patients get. The patients will seek out the follicular unit extraction so that way they don't have a scar. What the patient doesn't understand is they're going to actually have more scars. Each area where they took the follicular unit extraction from will have a little scar. So the patient will have polka dot scarring throughout the donor area. That versus having a linear line, which is what our previous patient Jeff had. Now Jeff's a good sport. He's going to allow us to do a follicular unit extraction on him just to show the camera, but then we're going to do a strip surgery. So we're just going to show you what the process is of doing that follicular unit extraction so that you can see what happens to those grafts. Okay, so if you take a look over here, we already kind of showed you what we're going to be using. What the doctors will use today are different size punch instruments. They're biopsy punch instruments that will take out the follicular unit one by one. Most doctors today are using a 1 millimeter punch. A 1 millimeter punch will get out that tiny little follicular unit. Now, imagine trying to take this little instrument and punch out a hair. Okay? That's what you're asking your doctor who does a follicular unit extraction to do. Blindly pull out a hair one by one so you won't have a scar. So what we're going to do is we're going to show you the different methods that are being done today, and we're going to show you why these methods make zero sense as far as the final outcome. Okay, so I'm going to use a 1.5 millimeter punch just to show you the process. I'm going to go bigger than what the doctors do. This is a 1.5 millimeter punch, and we're now going to take a follicular unit extraction out. When we're doing a follicular unit extraction, what we want to do is we want to isolate the follicle. And so basically we want to be able to isolate that follicle, the follicular unit. The follicular unit comes out in little bundles. So this is a little bundle here, that's a little bundle there, that's a little bundle there, and so forth. So what the doctor has to do is they have to isolate that bundle. Okay, so let's pick a little bundle right here. And they're going to take that little bundle out with the follicular unit. Basically do a little punch. Okay, just like that. Okay. So the patient's obviously not feeling anything because he's all anesthetized. And we take that out, okay? So now we're going to take this little bundle. Now, okay. So that's what we did. So now let's take a look at it. What's happened now on this particular one is the bulb of the follicle has been transected. So we tried to punch that one hair out, and look at where's the bulb? It's non-existent. We cut the bulb off. Okay, so this is part of the general process of what patients go through is they lose hair. Hair changes angles, hair changes directions, hair changes all over the place. So to try to pull out this blindly, okay, now that one just pulled the whole thing out. So now it's in my instrument. Right? I didn't do anything different. Now the follicular unit's now into my instrument. I pulled it out. Okay, now look it. This is what happens. We pulled it out. We have the bulb down here of one. We've now transected this other follicle. Okay, so my first shot, okay, all transection. Second shot, let's take a look at that. Bulb transection. So there's two shots. Let's go again. Okay. Now look it. We put these little holes in the patient's head. Okay. This is with a 1.5 millimeter punch. Most doctors use a smaller one than this. So there's much more room for error with the smaller instrument. So now let's try another graft. Say, look at this little guy. Here's a nice big one. Let's try to get this guy right here. Okay. So, thank you. So here it is in its environment. We're just trying to take that little guy out without destroying the follicle. Okay. So we pulled that out. Now let's take a look at this one. Okay, so now we pulled this one out, okay? Now we got a follicular unit. So we got a bulb down there, another bulb there, little transaction, okay. This would be considered a great follicular unit graft, believe it or not. Okay, that's called that would be considered a good one. So now I tried to pull 3 follicular units out. I got 1 hair here, no hairs there, and 3 hairs there. And how long did that just take? Okay, I just spent 5 minutes trying to do that. A lot of times these holes will leave that same scar tissue underneath. So the patient will get all these, just like they have this whiteness here. We're going to show you a video of a patient that has these polka dots everywhere. So when you shave your head, you can have multiple polka dots all over the back of your head. So for me, how can you explain to me, how can you tell me that this makes more sense than harvesting out a strip to get more hair for the patient, which will take less time? The answer is it doesn't make sense. Well, why are they doing this? Here's why they're doing this. They're going to be able to sell you more surgery because they're going to give you less hair. They're going to be able to sell you more surgery because it's less and you need more. So they charge you more money because they charge you by the graft. They charge you more money because it takes longer. It takes days, 2 days to do a big follicular unit case. I can harvest 78,000 hairs in about 45 minutes or less, where they would be pulling it out for 2 days and destroying your follicles. So any doctor who wants to tell you that this is a more productive surgery is not being forthright with you. You need to ask the proper questions. The question is what is the value of me having a follicular unit extraction? I had one patient who had a linear scar, and then the doctor went back and did a follicular unit extraction on him. Why would you do that? The answer is to make more money if you're the doctor. Because why would you, there's no reason. You already got a scar. Who cares? Now you're doing that so you can have a scarless surgery. It's not scarless. You're going to have these multiple polka dot holes. I'm going to show you one more example of this just so you can kind of get a feel for this. And I'll go for it again, even though I got a good one. Let's do one more. When there's a scar, okay, from the strip surgery, that changes the directions of the follicles. So now let's go by the scar and see how we do there. So if there's a previous scar. So now we're just going by the scar. Take that little friction out. Okay. Now, when they did the old punch grafts, what they would do is they would do the same exact technique. Okay. That exact same technique. Okay. So, take it again. And what they would do is they would just punch a bigger hole, so that graft would have maybe 15, 25 hairs. Okay. Here's a 4th follicular unit we pulled out. That's transected follicle, that's transected follicle. Okay, there is a bulb in there, so we did get 1 bulb. But now look what we did. We cut this hair, we cut another hair. So we got 1 bulb and cut 3 hairs. This one, we got 2 bulbs and cut 2 hairs. This one, we cut all the hairs. This one, we got 1 bulb and cut that hair. So this is what happens with a follicular unit extraction. You get limited results. You get less hair, it takes more time, and it costs the patient more money. So let's just spell these all out. So here's 1. Okay. Here's 2. 3. 4. Want to do a 5th one for the camera? So let's try one more, and let's go right by. Let's get in. So. Try to find a good one so we can get some hair for. And this is what they're going to do for you. They're going to try to pull these out one by one, just like this. Let's try this little guy right here. Right. Well, then how about this guy? Let's get this guy. Okay. So this is what they would have to do for you. Pull these out one by one. Okay, just like that. And you're going to tell me going in like this, you're going to be able to get good grafts? Well, I'm showing you how you don't get good grafts. So here's how that one came out. Look at that. I have 5. There's 5 grafts, all transected. I've been doing transplants for 15 years, and that's what you're going to be getting. It's garbage. Okay? That's why I do not recommend follicular unit extractions. I don't care if you're with the most skilled hands in the world, the odds of your transaction are going to go up considerably. It makes 0 sense. Why would you pay more money to get less hair? Why would you pay more money to spend more time in the chair for no reason? You're still going to have scars. You're going to have more scars. You're going to have more polka dot scars. So if your doctor is pushing a follicular unit extraction on you, ask him this question. How much hair are you going to be getting? Okay? How long is your procedure going to be? Is it going to take 4 hours? 4 hours in a follicular unit extraction case will get you about 500 hairs. It's going to take days to do a good big harvest for a follicular unit extraction case. And why? So you could have a scarless procedure? No such thing. Ask your doctor, oh, is it scarless? The answer is no, it's not scarless. You're going to have more scars. You're going to have more polka dot little hole scars, okay? There's no such thing as a scarless surgery. What happens is, underneath there, in each of those little polka dot holes, there's more fibrotic tissue underneath there, so when the next doctor tries to get more hair out of there, those follicles underneath there are affected because it changes the way that they are underneath as far as the direction and angle, so it makes it much more difficult for that next doctor to get more hair out for you. It's going to take you more time, cost you more money, and get you less of a result. Alright, so we're now going to do the strip surgery on Jeff. And it's interesting, as I was doing the recording, one of the technicians that I work with said, well, if a follicular unit extraction doctor sees this, they're going to have a lot to say about this. Well, here's what I have to say about that. Why don't you have your follicular unit extraction doctor show you before and after photos of one procedure results? And why don't you have him compare his one procedure follicular unit extraction results with my one procedure strip results? I have as many as you want to see. You can meet my patients up close and personal, and I have the full videos of the surgeries. So there's no smoke and mirrors here. So why don't you compare apples to apples? Why don't you ask that doctor, how long did it take to do that follicular unit extraction case? Okay, his answer is going to be 2 days. I'm going to pull 8,000 hairs out right now in about 40 minutes or less, not even. That's sewing it up and everything. So the patient will be out of the chair today within 4 hours, 5 hours tops for his whole procedure, and everything's going to be 100% undetectable. So the question that you want to ask your doctor is, show me your results, one procedure results, because that's what matters. Do you want to have more surgeries than you have to? Why would you want to go through this more than you have to? Okay? Okay, so we just got through harvesting Jeff's donor area. The whole process literally took 10 minutes to harvest what I'm about to show you. Then I'm going to go back and I'm going to suture him up, which will take another 10 minutes. So the whole process out the door is going to be about a half hour. Now you can take a quick glance over here as to what we pulled out. This is a ruler, which is obviously 12 inches. We do everything in centimeters. We have 2 separate half centimeter strips. They're each about 32-33 centimeters in length. Now what happens is, as we're pulling that donor out, we're trying not to transact that follicle. Okay, so if you look at this strip here, okay, what transaction is if a hair is cut, what I showed you when we were doing those plugs. So if you look at the bulb of the follicle and then the hair up on top where it comes out, so now what's going to happen, okay, is you can see I tried to pull that follicular unit out with this piece here blindly into this area. Okay, blindly into this area, trying to get that good graft. Now, as you might recall, how our grafts came out. Okay, our grafts came out transected, where we cut those hairs. Well, you can see how this graft came out, cut, cut, cut. Now you can see how it comes out when we take it out in a strip. It's a much more cleaner strip. All the follicles are much more intact because I have much more control. I can see what I'm doing as I'm taking it out, which makes it so much easier to get more viable tissue. Then my team will take this and they'll harvest the follicles out of here with magnification. So they're going to be able to see exactly what's going on. So it's not going to be me taking this blindly from behind and trying to punch this out without being able to see the angle, now I can see everything. It's opening it up and looking under the hood versus trying to work through the cracks of your car trying to fix your engine. That's what you're doing here. So look at that again, okay? Blindly trying to pull a hair follicle out versus seeing everything perfectly. Okay, so now this will go to my team, which is a team of experts. That's all they do. We use magnification, so we're going to be able to maximize the yield and get the most out of this for the patient, versus randomly trying to blindly pull these out and destroy the follicles. So you ask yourself this: what do you want? This or this? So and then we're going to show you how that comes out when we cut the grafts. This is what a follicular extraction looks like. Now we're going to show you what it looks like when we dissect that up. Now for those of you who are watching this, and if you're a doctor who does follicular extraction watches this, you're going to say, well, my grafts come out a lot better than that. I'm going to have a much better follicular unit than Dr. Bolton did. Well, let's say you do. Let's say you do a lot better than me on your follicular extraction. You're still going to have transection, and you're going to have much more transection than I ever would in a strip harvest procedure. And you, doctor, know that, and I know that. So why don't you tell your patient that? I showed you how those follicular unit extraction harvested grafts came out. That's going to be this top row up here. Then what I did is I had my technicians harvest the donor and dissect the follicles the way we do it here. Now, one of the things I want to make clear is that I am not a follicular unit extraction specialist. Although I've been doing hair transplants for 15 years, it's not my specialty. So a lot of the follicular unit extraction doctors are going to say, I'm going to get much better grafts than Dr. Bolton did. That very well may be true. But even if they are the most specialized follicular unit extraction doctor, no matter what, they are going to be getting transection of their follicles at a much higher rate than I am going to be getting out of a strip technique. Ask your doctor flat out, do you feel your transection level will be higher or lower with the strip technique versus a follicular unit extraction technique? If he tells you he's going to have a higher yield with follicular unit extractions, your doctor's not being forthright with you. All the studies show that follicular unit extraction will have a higher rate of transection than the strip harvesting technique. And that is factual.